Hi, my name is Dennis Daniel. I'm a physiotherapist at Dr. Rami Hamed Center. Today I'm going to teach you a few exercises for back pain. This is going to be especially helpful if you're having a desk job, or you are having a job which ends up like an IT job, or a job which ends up sitting for more than 6 to 8 hours. And this is ideal for those people who are starting to get back pain, or they want to keep back pain away in their lifetime. These are very simple exercises which you can do at your home, and most importantly, all the exercises which are being shown here should be pain-free. So our first exercise today is something what we call as a back raise exercise. It would be preferable if you have a mat for this exercise. You have to be lying down on your tummy for this exercise. So first you need to lie down in this position, and if you are suffering from spinal canal stenosis, you wouldn't want to do this exercise. For people having normal back pain, this is going to be a great exercise to relieve your back pain. So first you need to make sure you're lying down with your hands by the side, and you start off very gently by a back raise. So slowly you come up and you go down, and you can do 5 reps of this exercise and see if you're having any pain. If you're comfortable with this exercise and if it's absolutely pain-free, you can do another 5 reps. So once you do 10 repetitions, you take a rest, and then you do another 10 repetitions. So after you do this for a couple of times in a day and you feel this is okay, you can progress to what we call as a back spinal stretch. So what you do is, this time, until now, we did not raise our elbows up. From now on, we bring our hands a little bit to the back to help us go a little bit up. So points to remember is, you have to make sure your pelvis is on the ground and it doesn't come up, and you can go up till wherever you feel comfortable, and it should be absolutely pain-free. If this exercise is making your pain worse, you should stop that exercise and should stop from doing it. But if it is relieving your pain, you can continue doing for another 5 to 10 reps. So remember, if you want to go higher up, you bring your hands a little bit closer to you, and you can try a new range. And if you're comfortable right there, you can stay there for around 5 to 10 seconds and then gently come down. You can do this for 3 to 4 times as a stretch, but again, remember, this shouldn't make any of your symptoms worse, or you shouldn't have any pain while doing this. Alright, our second exercise, for this you need to be in all fours. So you make sure your back is straight, and we call this exercise alternate hand and leg raise, or you can call it alternate Superman. So in this exercise, you make sure your back is straight, and then you straighten your hand and leg, the alternate hand and leg, and then bring it back to position. And after that, you try the next hand and leg. So if it's your left hand, it's going to be your right leg, and then if it's your right hand, it's going to be your left leg, and it should be a smooth rhythmic movement. Again, you shouldn't feel any pain while doing this exercise. Alright, for your third exercise, this is a little more easier exercise and a more of a relaxing exercise. We'll also teach you stretching in the same position as well. So for this, I want you to be lying down on the mat, bend both your knees, and start with a very gentle side to side swing. You don't have to really push it here. Very gentle side to side swing. So you start off with the swing very gentle, like a pendulum, and make sure you have no pain while doing this. So you can do 5 repetitions to one side, then 5 to another side, and if you feel this is relaxing you and relieving your pain, you can even go to a stretch. So what you do is, once you finish with the initial warm-up kind of side to side swing, you move to one side to give you a very gentle stretch. So once you start getting the stretch, you can stay there for 10 to 15 seconds and then slowly go on to the next side. And once again, you stay there for 10 to 15 seconds. Now, if you are having pain while doing stretching on one side, you can avoid that side and just continue with the side which is pain-free. So remember again, you shouldn't be having any pain and avoid the side which you're having pain. And you can just continue stretching to the side which you are comfortable. This is your fourth exercise, and this is almost the same position as the last exercise. So you have bent both your knees and your hands are by the side, and this time you just have to lift your hip up. We call it the bridging exercise, and then gently keep it down. Once again, lift the hip up to wherever you're comfortable and then gently keep it down. Remember, it should be done in a pain-free range and you should be comfortable with it. So you very gently raise it up. If you want, you can hold it for 1 or 2 seconds and gently put it back. At 10 repetitions, 2 sets would be great to start off with. So these were the 4 exercises to reduce your back pain or to make sure the back pain, you keep back pain away. Now, the points to remember, if any of these exercises is constantly giving you, increasing your pain or increasing your symptoms, you should stop that exercise and not continue it. This is excellent for people who, if you have a day job and you're sitting for long, if you can do it at least once or twice in a day, this will be fantastic. So we'll be coming with more videos like this to help you and more exercises. So until then, this is Dennis Daniel from Dr. Rami Hamay Center. Our advice to you before we sign off is keep moving more. The more you move, the better it is for you. Thanks.